name is Sandra Chapman. I'm the Chief Program Officer for Borough President Eric L. Adams. And I want to welcome you this evening to Borough President Adams' second World AIDS Day Community Forum in collaboration with Circle of Voices, Inc. We have decades of experience sitting around the tables for today's program. I know that these speakers work tirelessly to inform and advocate and educate our communities. So in advance, I want to thank them for giving of their knowledge and time this evening. The first cases of AIDS were reported in the city by the Centers for Disease Control in July 1981. Recently, the New York Times reported that in 2016, 2,881 people were newly diagnosed with the virus in New York, compared to 3,163 in 2015. The fall in the new infections can be attributed to New York State's 2014 education and anti-HIV innovation efforts. For the number of people affected by this epidemic to continue to decline, funding is a major key. This evening we will discuss replenishing funding for HIV/AIDS prevention programs and one other topic that I will explain later. Although the numbers of those infected have declined, we still have a way to go. This disease is a problem worldwide and in our country, but it affects communities of color disproportionately, especially in some of our Brooklyn neighborhoods, where the highest rate of HIV diagnosis in 2016 were Bedford-Stuyvesant, Crown Heights, East New York, and Williamsburg-Bushwick. We would like to see more focus on reaching young people who are most at risk and who are the least likely to know whether they are infected. Hence, the second topic I just said we will discuss today, sexual health education within the Department of Education. Before we begin the forum, I would like to introduce you to our guest speaker and moderator, Ms. C. Virginia Fields. Elected as Manhattan Borough President in 1997, Ms. Fields was instrumental in the allocation of millions of dollars for programmatic support to community-based organizations and educational institutions borough-wide. She is the President and CEO of the National Black Leadership Commission on AIDS, Inc., serving since 2008. Under her leadership, the program has grown to include 11 affiliates and more than 150 national partners. Throughout her tenure, NBLCA's outreach has increased through expanded local and national programs. Ms. Fields?
Thank you so much. And sometimes when you hear the word keynote speaker, you think there's going to be a long speech. Trust me, that is not the case. I will be doing more moderating with these distinguished panelists who have been gathered tonight for this event. So first, let me thank our Brooklyn Borough President, Eric Adams, and his partner, Cass Mitchell, here with the Circle of Voices, for bringing us together to explore these issues and others that we hope, as we engage the audience, that we will identify things that must be needed in order for us to change the narrative that you just heard with respect to what is happening right here in Brooklyn. Of course, we just finished with World AIDS Day 2018, and I'm sorry, 17. And clearly there are good things to talk about because progress has been made since we first heard about what HIV/AIDS is from the Center for Disease Control. Antiretroviral treatment has made it possible for people to live longer and a better quality of life as long as they get tested, stay on the medication, and follow the medical advice that is given them. Here in the state of New York, since last year, we have not had one infant born with HIV. The transmission, of course, Dr. Sweeney, you remember, as most of us do, the border babies lingering in hospitals. And many of them now are adults, and they're able to talk about moving from pediatrics now to living healthier lives. We know about PrEP, we know about pre-exposure prophylaxis, we know about PEP, post-exposure prophylaxis. So we've done a lot, but as we will see soon with the statistics coming from the Department of Health, New York City, we still have a long ways to go with respect to getting those numbers down and keeping them down. Why is it that African Americans who go into treatment do not stay in treatment so that the viral load can continuously go down? We hear a lot about that, and that question is never really answered. We just hear they came in, they dropped out, and therefore, or transmitting the virus maybe unwittingly or unknowingly. So those are some of the issues that we're going to discuss tonight, and we ask you to work with us to engage. And the other thing I want to put on the table, and hopefully we can have a chance to even give some attention to that, and that's the whole notion of a vaccine. Dr. Fauci of the National Institute of Health recently wrote an article, and he said, not without a vaccine, that we will not end this epidemic without a vaccine. So we have to continuously ask ourselves the question, where are we on the road to a vaccine? And we know that clinical trials are important, and we as Black folks and as Latino folks oftentimes don't want to participate in clinical trials. So those are some of the things that I think we're going to have to think about as we move to implement the governor's blueprint to eliminate or significantly reduce the number of HIV infections from that 3,100 so numbers that was just mentioned to 500 by 2020. Now we're at the end of 2017, so we don't have 2 years to go, and we need to be monitoring that also. So with that having been said, I want to thank again the Borough President and want to thank Circle of Voices for bringing us together for this critically important discussion.
Thank you. Can we greet? So before we begin the panel discussion, we will ask Dr. Christina Rodriguez-Hart, HIV Epidemiology and Field Services Program of the Department of Health and Mental Hygiene, to provide us with the results of the HIV/AIDS surveillance data for Brooklyn.
Okay. Do you want me to speak from here or from over there?
You have it, so you could speak from there. You have a mic, whichever makes you comfortable.
Okay. Thank you so much for having me. Can everyone hear me?
Yes.
Okay, good. Okay, so where do we stand in 2016? Because that's the latest year of data that we have, and it just came out really for World AIDS Day last week. So these numbers are fresh and new, and they're on our website, and then hopefully by end of January we'll have our reports and stuff in print. Okay, so I'm going to start with just big broad picture of New York City, and this is the past 5 years of data that we have, and this is the bars represent the number of new HIV diagnoses per year, and the line represents the rate per year. And what we see with both is that the numbers are steadily declining, and at 2,279 new diagnoses in 2016, that is the lowest number on record since the beginning of the epidemic. So we are headed in the right direction. Okay, so Brooklyn. This is some overall stats for Brooklyn. There were nearly 30,000 individuals living with HIV/AIDS in Brooklyn in 2016, and this represents about 1% of the population in Brooklyn. There were 581 new HIV diagnoses, which is the highest number of all 5 boroughs, and it represents about a quarter of all diagnoses in the city. About 19% of these new diagnoses were shortly followed by an AIDS diagnosis. And we pay attention to that percent because it indicates that these are individuals we're catching very late in terms of their HIV infection, and we need to be testing people earlier, so we monitor that percentage. There were 277 new AIDS diagnoses in 2016, and there were 340 deaths among people living with HIV/AIDS, or PLWHA as we commonly say. And I'll speak a little bit more about death later on in the slide. Okay, so it's important not just to talk about numbers of new HIV diagnosis, but to also talk about rates of new HIV diagnosis, because a rate takes into account the population size of the area that you're talking about, whereas a number doesn't. So even though Brooklyn had the highest number, if we look at these lines, and Brooklyn here is the red line, so the third highest line. Once we account for Brooklyn's large population size, it is the most populous borough, we see that its rate is lower than the Bronx and Manhattan. And that, like them, it has been steadily declining over the past 5 years. Okay, so then this is looking at new HIV diagnosis by both borough and by gender in 2016. And we have males in the left pie chart, and we have females on the right. And Brooklyn is the segment that's in red. Among males, males that were diagnosed in Brooklyn represented about a quarter of all new diagnoses in the city. And among females, nearly a third of all diagnoses among females in the city. So we can see that Brooklyn has a disproportionate number of the diagnoses among females for the city. Okay, this clicker seems to have a delay effect. Okay, so now we're looking at numbers of new HIV diagnoses in Brooklyn over the past 5 years, but broken down by age group. And the age group that's at the top in red are individuals living in their 20s. So consistently, individuals living in their 20s have had the highest numbers of new HIV diagnoses. And this is a similar graph, except it's looking at the numbers by race, ethnicity. And what we see is that consistently over the past 5 years, and really longer than that, Black or African American individuals have had the highest numbers of new diagnoses in Brooklyn, although the numbers are decreasing with time. Ooh, I think I skipped one. Okay. So this is just 2016, and here we look at the intersection of both race and age. We have each of the race ethnicity groups, starting with Black individuals, and Latino, then white, and then Asian Pacific Islanders. Across all of these racial ethnic groups, individuals in their 20s have the highest numbers of diagnosis, which is, they're included in the light blue bars. But if we look just at Black individuals to the left, we see a kind of unique pattern that's a little different than the other racial ethnic groups. And among Black individuals, not only are those living in their 20s having high numbers of diagnosis, but also individuals in their 30s, which are the red bars, and individuals in their 50s, which is the blue bars. And we don't really see that trend for the other racial ethnic group. Okay, this is a similar graph, but now we're looking at transmission risk by race ethnicity group. So when someone is diagnosed, someone from our program goes out and interviews each newly diagnosed individual and asks them about their behaviors and about factors in their life in the year prior to diagnosis. So that's how we get this information. And across all racial ethnic groups, we see a pretty consistent pattern, which is that the group that has had the highest number of diagnoses are men who have sex with men, which we often call MSM for short. Although among Black individuals, a higher proportion that are also heterosexual if you compare them to other racial ethnic groups. So this is a graph showing numbers among transgender individuals by borough. And even though the total numbers of new diagnoses among transgender individuals are not high, we do see that the borough that has the highest number of diagnoses among transgender individuals is Brooklyn, with the red bar. And most of our diagnosis in the city, as well as in Brooklyn, among transgender individuals is among trans women of color. So Black and Latina trans women. Okay, and here we're looking at new diagnosis, but for individuals that were not born in the United States, so born outside of the United States, which we often call foreign-born. In terms of the proportion of new diagnoses that were among individuals that were foreign-born, it was 29%, which is the same as the citywide average. Here we have a pie chart that shows a breakdown by region of foreign-born birth. And what we see is that the region that the most individuals came from is the Caribbean at about 40%. And the top 3 countries were Haiti, Jamaica, and also Guyana. This is a map of New York City, and it shows by zip code the numbers, the rates actually of new HIV diagnosis. And so the darker the color of the zip code, it means the higher the HIV rate. And if we look at Brooklyn, we see that the zip codes with the highest rates seem to cluster in the northern part of Brooklyn. So there's not just randomly distributed, but there's some geographic component of who's getting diagnosed. And the neighborhoods that had the highest rates were Bedford-Stuyvesant, Crown Heights, East New York, and Williamsburg-Bushwick. This is a similar map, but it's actually showing death rates among those living with HIV/AIDS in 2016. And what we see is that it's fairly similar to the map that shows new diagnosis rates. And in Brooklyn, the neighborhoods with the highest death rates were, again, Bedford-Stuyvesant, Crown Heights, and East New York. These 2 lines show the age-adjusted death rates among people living with HIV/AIDS in New York City in the blue line and Brooklyn in the red line for the past 5 years. And these rates have actually been pretty similar to each other, but in 2016, the rate was noticeably higher in Brooklyn than it was for the citywide average, at 8.5 in Brooklyn versus 7.5 in New York City. And at this point, most causes of death among people living with HIV are actually due to non-HIV related causes. So things like cancer, major cardiovascular disease. So it just indicates that when dealing with our PLWHA populations, we have to be paying attention to the rest of their lives and other illnesses that they may be struggling with, and not just focusing on HIV. Okay, now we're going to look at some more care-related outcomes rather than new diagnosis. And this compares the boroughs in terms of timely initiation of care. So whether we link someone who had been diagnosed into HIV care within 3 months after they were diagnosed. And Brooklyn is in red again, and it has the percentage 70%, which was one of the lowest of the 5 boroughs. And to put this in context, the CDC is now looking at timely initiation of care within 1 month. So they want us to actually be getting people initiated into care more rapidly, and that's because the science is telling us that people recently infected are highly infectious to other individuals, whether they realize that they have the infection or not, and also because the sooner we can get people on medication, the sooner that we can bring that amount of virus that's in their blood down, so that they can live longer, healthier lives, but also so that they won't be able to pass HIV to other individuals. So it has both a benefit for the individual and has a benefit for the community. And also to put this in context, I believe the national average was, I have it somewhere here, I think it was like, I'm gonna find it so I don't lie. It was 75% was the timely initiation of care proportion for the US for 1 month. So we're lagging behind a little bit here, because here we've got 3 months, even more time to have initiated people into care. Okay, and this is the HIV care continuum for Brooklyn. We look at this a lot, It helps us see where are the gaps in terms of the quality of services that we're providing and where people perhaps falling between the cracks. And what we ideally want to see is that all 5 of these bars are at 100%. So we've got 100% of those that are infected, diagnosed, then retained in care, then prescribed HIV medications, and then the last bar is viral suppression, which means having your viral load low enough so that you're not likely to pass it to another individual and you may actually be undetectable. So for Brooklyn, 74% of individuals living with HIV/AIDS were virally suppressed. And if we compare this to the citywide average was actually 76%, so it was only a little bit lower. Okay, this looks at viral suppression a little bit more in depth. And so this is viral suppression within 6 months of diagnosis. So ideally, again, we want to get people virally suppressed as quickly as possible. And Brooklyn is in the red bar, and what we see is that 52% of individuals newly diagnosed in 2016 were virally suppressed within 6 months, and that was actually the lowest of all the boroughs. So this suggests some areas of improvement. Okay, so in terms of Brooklyn as a whole, the rate of new HIV diagnosis in Brooklyn is at a historic low, at the lowest point that it's ever been. And it's important for us to look at the rate as well as the number, because the number tells you how many people were diagnosed, but then the rate tells you how to compare it to other boroughs. In terms of who's most impacted in Brooklyn, it was males, young adults ages 20 to 29, and Black individuals that account for the most new diagnosis. In terms of transmission risk, it was males having sex with males. Nearly a third of new diagnoses were among people born outside of the United States, and over a third were from the Caribbean of these individuals. Deaths are declining, which is good news, although in 2016, the death rate in Brooklyn was higher than the citywide average. Levels of timely initiation of care and achievement of viral suppression within 6 months were lower in Brooklyn than they were in other boroughs. And then I heard that we're focusing a bit on Bedford-Stuyvesant and Crown Heights, so I just wanted to put their data in there as well. And we actually, on our website, we have these numbers for every, what we call UHF, every neighborhood. So I'm focusing on this one today, but you can go up and look up other neighborhoods. So in this neighborhood, in these 2 neighborhoods combined, there were 7,841 individuals living with HIV/AIDS in 2016, and that represents about 2.4% of these areas' population. So if you remember, the number for Brooklyn was that PLWHA represented 1% of the Brooklyn population, but here we have 2.4%, so more than twice the percentage. There were 171 new HIV diagnoses. Again, if we look at the rate for this area was 53 compared to 22 for Brooklyn as a whole. 29% of the new diagnosis in this area represented 29% of all diagnoses in Brooklyn. And about 22% of these were concurrent with an AIDS diagnosis, meaning that these individuals were tested quite late in the progression of their infection. And I looked up a little bit of the demographics, and I found that this area only accounts for about 12% of Brooklyn's population, and yet it accounts for 29% of the new diagnosis. So this area is definitely disproportionately impacted. There were 96 new AIDS diagnoses, and the death rate was almost 12 deaths per 1,000 mid-year persons living with HIV/AIDS. And if we compare that to the citywide average was 7.5. So it's much higher. Okay, so if you'd like to find out more information, you can go to our website. We have our annual report that has just been released online. We have slide sets that are similar to this, but they will focus on different subgroups. So we have a slide set, for example, for MSM, a slide set for transgender individuals, a slide set for females. So that's a good, if you're looking for information, that's a good first place to look. We also have tables that go even more detailed. And then if you don't find what you're looking for there, please reach out to us. This is an email address that you can reach us at. And it usually takes about 2 weeks to turn around the information that you're requesting. So thank you, and you can always reach me at this email.
Thank you. Thank you again, Dr. Rodriguez-Hart. So we are about to begin our conversation, but just some introductions. So I will ask our panel, I'll go around the table and I'll start with our partner. I'll ask you to just give your name, your title, and the organization that you're with.
Good evening, everyone. I'm Kaz Mitchell, Circle of Voices Director.
I'm Dr. Monica Sweeney. I'm the Vice Dean for Global Engagement at the SUNY School of Public Health at Downstate.
Greetings from the National Action Network. I'm Dr. Alvin Ponder. I serve as the Vice President of the New York City chapter of the National Action Network, headed by Reverend Al Sharpton, and I'm the chair of the HIV/AIDS committee there. I'm also a member of the NAIDS New York Community Coalition, which I guess most of the members are also. Thank you. Sorry I'm late.
Good evening, Hector Quiñones, Director of Social Services at Upton West Project, Best in Bushwick.
I think you guys all know who I am.
I'm Ellen Cates, Medical Case Manager and RAP Specialist at the Bedford-Stuyvesant Family Health Center.
Hi, my name is Eddie Dillard. I'm the Associate Director at AIDS Healthcare Foundation, Brooklyn.
Good evening, I'm Dee Bailey. I'm the founder of Watchful Eye.
Good evening, Dr. Cicely Johnson. I'm the Associate Executive Director of Research and Training at the Arthur Ashe Institute for Urban Health.
Thank you. Thank you all. I will now turn it over to our distinguished moderator.
Thank you so much. Coming out of that PowerPoint presentation, we have a couple areas. We want to talk about funding, we want to talk about education. But I'd just like to go around the table briefly and ask you your reaction to a lot of what we just saw. Lots of really good news as far as hearing that rates are going down. Not so good news, African Americans, Latinos still disproportionately infected. And we always have to keep in mind that data are not just numbers, they represent human beings, they're people. So when we think about people in the sense. So I'd just like to, anyone and everyone, we have about 45 minutes for this panel. So would anyone like to just give their brief response or reaction to what you just saw? Panelists.
I'm very happy about the good news. I always talk about mother-to-child transmission. Many things that we are experiencing now came after very, very long and ugly fights, but it's now time to celebrate some of the things that have really paid off. One is mother-to-child transmission, and I won't say any more about it than that. When you have 0 to 1, 2015 0, 2016 1, that's really great news. The other thing to celebrate is that the death rate is not in the causes of death. HIV and AIDS is not in the top 10 anymore. And that's something to really celebrate. For a long time, for the Black community, it was in the leading causes of death, and that's not the case anymore. But we have so much to do, and I just thought that it would be interesting to talk about what's going on that young people in their 20s are not coming out with the knowledge or understanding or trust in the system that helps them not to become infected. And I just hope that we'll spend some time talking about what's going on in the city, that we are not at a point that people are able to be coached, educated, encouraged to use something in the toolbox to prevent them from becoming infected.
two other comments, if anyone. Dee?
Yes, I'm not as happy about the slideshow, maybe as Dr. Sweeney, and I understand she was there. She's been a part of the change in terms of, as a clinician, in terms of the diagnosis. I'm very much disturbed about this linkage to care and people having access to care. Brooklyn lost the Brooklyn United Community Coalition. Brooklyn lost the Brooklyn Linkage to Care Coalition. Brooklyn lost its HIV Care Network, where we had all of our agencies, over 400 agencies working together, hospitals, coalitions, all different types, the Arthur Ashe Institute. This is what we've lost in these same years that you showed us our decline in terms of people being linked to care in a timely fashion. The CDC back in 1999 started these 9 coalitions that were nationwide, and all these coalitions, which started in Bed-Stuy and Crown Heights, was the #1 coalition. And we worked hard on that for 3 years. And we developed a study, and we surveyed, and we developed the linkage to care, and we developed all of these things. And then when that funding was over, or when they redirected their attention elsewhere, the money was pulled from our community. And those organizations that were in charge of doing it went out of business or went on to do other things. We have a direct responsibility to acknowledge here in Brooklyn what happened to us as a people when it came to black people or people of color dealing with HIV and AIDS. There is an absolute responsibility that I hope our borough president will look at and say, wait a minute, I understand it's all good that these numbers are declining and through the good work and through the therapies and antiretroviral therapies. But let's talk about what Dr. Sweeney just said. The next generation are still being infected. I'm over 60 years old. My grandchildren are coming up. Your grandchildren are coming up. What's going to happen to them? And they know nothing about the things that I'm talking about right now because nobody's talking about it. So somebody needs to explain that to me, and I've been around a while.
Okay, we'll have one more comment.
Yeah, let me briefly,
And then we'll go
let me
to-
briefly-
Hold on, Dr. Palmer, because 2 points have actually been brought up that we were going to address. The younger people, they were not around in the 80s and the 90s and even 70s when we saw so many people die. And the funding, the shifts in funding, and what impact has that had? Dr. Ponder.
Now, am I answering the second question with the
No,
shifts
no,
of funding
you're
or my
You're
original?
responding right now to what you saw on the power presentation.
Yeah,
your reaction.
I'll be very brief. Though it was very sobering. When I came in, and I'm sorry I'm late, and one of the great interests I had in coming here is because Bed-Stuy is where my wife grew up. And these are sobering results. But when I came here, the first thing I heard was viral suppression. That's what stuck up in my mind. Let me ask you a question. I'm going to be very brief. Mm-hmm. Does everybody know what viral suppression means? Raise your hand if you know what viral suppression means. All right. Let's go through it in 1 minute. Virals, and sometimes we call it viral load suppression. Let's say I took this jar right here. It's filled with water. Let's say this represents your body that's filled with viral particles. You got that? So now, every time I take my medicine, my antiretroviral medicine, I'm going to take a sip of this water. And my viral load is going to go down because remember, the water represented the virus. Okay? So what does that mean? I'm a physician. I think there's another physician here, but you don't have to be a physician to know what that means. What that means is that, well, viral load, if I put this on a triple beam balance, that would be the load, true? And if I can get my viral load down, there's been studies, 200, T cells. If I can get my viral load down, if I can what? Suppress it satisfactorily, it will not progress to AIDS. Just look at that morbidity. And furthermore, I will not transmit it to another person. So you can look at the population statistics, and that one concept right there, that one concept can turn much of those statistics around. Now, I'm sorry,
Your term is up.
Madam.
Your time's up.
I was filled. I was
But that's
through.
a good point.
I
Thank
was
you
through.
so much.
I was through.
Regulations go under here in the city of New York, the state of New York, that were established to specifically service communities of color, African Americans and Latino communities. So the replenishing, how do we replenish funding in order to make sure that primary prevention is a key part of this narrative in moving forward? Because we've seen shifts now, funding for treatment, care. People who are living with HIV and AIDS, yes, we have an obligation and a responsibility to care for them. There's no question about that. But what are we doing to successfully, on the prevention side, through funding these organizations, to ensure that those numbers continue to go down? Okay, Cass, we'll start with you on this.
For those of you that don't know Circle of Voices, we are an all-orientation, women-based organization. But because we love people, and because people know me for being active in the community, we service everyone. And when it comes to funding, because Circle of Voices is small in operations staff, we're all volunteer, but we're big in connecting. What we found is that we are the trusted organization that feed the larger organizations that are getting the millions of dollars. So case in point, Circle of Voices will know and have, say, women of color, or say black women that are same gender loving, queer, and we have to send them to places like the center, to Cal and Lord, and we can't get that money because those orgs have combined numbers when you look at them on Facebook, 100,000 K likes to our 2,000 likes. But we have the core group that needs the service. So one of the things that I would like your commission to look at is how much money they're giving these big guys who we, the little guy, is feeding them and they give us nothing. But we hold the principal players. And most of our people are Bed-Stuy, Flatbush, Crown Heights, East New York, the one group that is dying. So please look into that disparity. These people are getting millions of dollars.
We're gonna go this way, this way, this way. So anyone on this side who wants to speak, anyone on this side, okay.
I just want to answer this question and then go back to the first one if I could have a few
Okay,
seconds
you
on
got
that. But in terms of the issue of funding, that's one of the major things that Arthur Ashe, as a community-based organization that's rather small, struggles with quite often. And we often find ourselves in the position where we're conducting the ground-breaking research on certain things, and we may wind up getting a $10,000 grant for it.
Or a computer.
Yes. Something small that is not going to allow us to further our programs in the community of East Flatbush and other communities that we serve. So we may produce some qualitative research about, well, what are Caribbean men saying about HIV/AIDS and their comfort with going to the doctor, or things like that. They'll take our research and they'll move it on to a larger company and they'll get the $1 million grant to further that research. So that is definitely a problem that needs to be looked into. Going back to just the initial question, I also just wanted to kind of spend a moment on my reaction in terms of my concern to the younger demographics and HIV/AIDS in Brooklyn. So we have conducted at Arthur Ashe quite a few qualitative research studies that look at a myriad of things: HIV/AIDS, prostate cancer, cardiovascular disease, for young black males and young black women between the ages of 29, 30 to 39. And we're, again, having that funding issue of really furthering the voices from the data that we get for those groups. In addition, we realized this summer, during our internship program that we host each summer, that HIV and AIDS were topics that our high school students just really didn't have a solid understanding of. In addition to not having a solid understanding of it, their idea of health and sexual education, which I know is on the agenda for tonight, was completely skewed, right? In terms of looking at what is love, what does it mean to have agency over my body, what is sexual education, how do I find out this this information? Where do I find it? And I think that that was something that we definitely wanted to spend some more time on. Again, we don't have any money for it, right? So we had to kind of take our small qualitative sample from our internship program and look for some funding to continue seeing what are the thoughts of our high school students in terms of sexual education and transmission of STDs and STIs.
Whereas your research and qualitative data should guide funding sources.
Yes.
Anybody else,
just-
Doctor, would go this?
Yeah, I just wanted to mention that, she mentioned about community-based organizations and the role that they play in all this, and basically the fact that we have been underfunded for a very long time, and when it comes to doing all this prevention work and the linkage to care and the navigation to services and to medical providers, basically it is at the community-based level that it happens. When you look at these numbers and you look at who are the people that are missing in this chart that is supposed to boost these numbers up, when you look at those numbers, basically it's the people with mental health issues, it's the people who are still actively using, it's the people who are homeless, it's the people who are basically living in poverty, that instead of going to a doctor, they're gonna use their money for something else. And how do you engage these individuals at the community-based level to be able to navigate them into medical care and services? I have to say that when it comes to the models that they're utilizing now, is mostly medical models. Community-based models are non-existent. Most of the funding are shifting into basically the medical models. And when I look at it, there's no medical model without community-based navigation and the peer engagement and having these clients coming into a place where they feel comfortable. And another thing that I wanted to mention was the fact that when you look at these numbers too, women, the numbers are going up here in Brooklyn. So, what are we doing to be able to address the epidemic with women? I think something has to be done. When you start putting all your funding in one bucket because the numbers are so high in that bucket and you forget about other populations, sooner or later those other numbers are going to start going up. When you look at what's going on with substance users and the perinatal transmissions, they went down because they put the funding into it. When it goes to substance users, when you look at it right now, recently I was in another meeting and I think for the whole year in the whole state, 76 people got infected through injection drug use.
Right.
So that means that harm reduction services is an effective prevention tool. But here we are, most of the times, the funding doesn't go where it belongs.
Everybody's gonna get a chance to speak, but I'm gonna go here on this side for someone who hasn't spoken. We'll come back to the ones everybody's gonna speak on. If you want to, Edwin or Ellen, do you wanna make a comment?
Over at Bed-Stuy Family Health, we've had to revamp our model. It is medically based, but we've incorporated the use of peers to outreach to the community, to our patients, our clients. And we've noticed that there has been a little shift, a small shift. The problem is folks are coming in, and as we've already mentioned, the funds being cut, a lot of them are coming in with mental health issues that cannot be addressed in the medical model. And although we have a behavioral grant, it's limited. And they're coming in with all of the issues that you mentioned, in addition to multiple diagnoses that we as case managers, we as specialists are unable to address. The mental health specialists are overwhelmed with trying to treat and deal with these issues, and the little grant only allows for us to have 2 people. And when you try to refer folks out, by the time they get referred out, they see a doctor, it's like 2 or 3 months. They're not coming back in there. They're scattered. So it's really difficult in bringing them in, keeping them in, and trying to address the real issues: housing, the mental health issues, getting medications. Our doctors can't give them the medications that they need to give them for their mental health issues. We try to do our best, but it's out of hand. It's really gotten very complicated. With that being said, I know that we've done a tremendous job in getting them in with our new peers. We're utilizing peers. We're trying to bring back the groups and things like that to keep them in, yeah, you know, because otherwise they go back out there and they start using and they start getting caught up in the different things that's going on. I think we've been pretty successful in accomplishing the viral load suppression, getting them their medications, keeping them engaged, but this mental health issue is a major issue over at Bed-Stuy Family Health.
Dr. Sweeney wanted to.
Yes, mental health issues is not just a problem for Bed-Stuy and Crown Heights. It's a issue for all of New York State, especially in underserved communities, because there are not enough practitioners who engage or who come to our communities. So we did a study, I won't even go into it, but and I've forgotten exactly, there's 5 psychiatrists for every 100,000 people on the Upper East Side, where there's 1 for about 1 million in the neighborhoods we're talking about. So we have to address the social determinants of health, and if we don't, the numbers will keep going up in the groups where they are, because people self-medicate. They self-medicate with drugs, they self-medicate with alcohol, which is a drug, they self-medicate with sex, they self-medicate with food, and so if we don't address the social determinants of health, we're going to keep getting the same results. Back to HIV specifically for a minute, there's supposed to be a K through 12 comprehensive sexual health program in New York City. What's happening? It's not being done. Yeah. And we need to make sure that the people who are responsible for it, when I was assistant commissioner, I went to various schools to see how it was being implemented. Half the people responsible for it didn't want to talk about sex. The others didn't have time. So we have this program on the books, and young people are getting infected because they don't know, and we are not teaching them. So we have something in place that's not really in place, and we need to make sure it gets in place. I'll stop there.
Ms.
Okay,
Fields?
D.
Yeah, I was just gonna say.
Now that we have both of the topics, let's just go for both of them. Funding, comprehensive sex education, younger people.
Yeah.
Okay, go.
Watchful Eye has our Young Speakers Bureau. Everybody knows anywhere you see me, you see these bunch of young people. They do martial arts and they do steel band and they do what we call edutainment. You've seen them at the Universal Circus performing, and at the end they say HIV is 100% preventable, get tested, and you see them outside handing out information and just kind of letting people know. But we do all of that on our own. Dr. Sweeney, I can tell you Watchful Eye is in 13 public schools right here in Brooklyn. We have a piece of that curriculum, if you please, but it's done in an after-school program type setting. It is not done during the day with the principals, okay, and all of that. We be creative. We are creative in how we get those messages and how we do the basic training and educating, getting people more involved. But with us in our community, we always have to get creative when it comes to educating our people. It's time for us to get funded so we can stop being creative and let's start saving the lives of our people.
Dr. Ponder?
Yes, I'll be brief. I have my timer on. And you know, Ms. Fields, and by the way, if I show unusual deference This is my mentor from some 20 years.
I'm not sure I did that well with you, Jim.
I was boast about that.
That's all right. She's just putting me in my place. We just met, Ms. Fields, and she probably can give you a lesson on this question of how do we replenish funding to make sure that primary prevention is a key part of the narrative moving forward. And we just had a meeting in the Speaker's office with Mr. Gardner, and we dealt with that. And all of these taxpayers and voters, that's why this question is so important. And it's going to take millions of dollars. I think we've allocated something like, our ask is around $10 million. Okay, you had mentioned the sexual education bill that's on the ropes because it is a sensitive subject upstate, and we have to be able to, in trying to win these monies, try to be able to present it in a manner that is politically tenable, right? That upstate will be able to deal with. So what you can do is to write your assemblyman. The assembly has not given us a dime, and they resented that, Ms. Fields, when we told them that, saying that if the executive budget has all of this millions of dollars, and they got billions of dollars. Okay? And they said, well, they could not put, Ms. Fields, even one dime in their one assembly house budget. Okay? But they said, well, since in the executive budget you have monies going towards that, then that is telling you how we feel. No, it is not. It's not. It's not. Okay? Because it tells us what their priorities are. And so what you can do is to write your assemblyman, write your state senator. That's 2 minutes and 19 seconds.
Thank you, Doctor. Well, as we always said, as a former elected official, your budget where you put your dollars reflects what your priorities are. So that's absolutely correct. But going back to something Dr. Sweeney said, and we are actually fortunate here in the state of New York, we're one of the few states where comprehensive sex education is required to be taught in our public schools. And most of you will remember when Mayor Bloomberg was in office, he began to move on the path to mandate it. And at that time, we hit the crisis around the bus strike. So everything was diverted, detracted from that, and we never got back on track about it. So public schools are required, and the question is, why are they not teaching comprehensive sex education, which deals with human sexuality, HIV/AIDS, and just human sexuality? And I think there was a study done out in Michigan that showed when young people get good information in their schools, and hopefully backed up in other places, in the home, and other significant adults in their lives, that they were changing their behavior. They weren't stopping having sex, but they were using condoms, engaging in protective sex. So it works. At the federal level, as I understand it, and I don't think it has changed, states only get funding for it if they teach abstinence. So it is a political issue. But at the same time, here in the state of New York, because it's mandated, maybe one of the things that collectively we can think about is pushing that issue to have them, and the UFT, I've had conversations with UFT friends there too. They don't have teachers with the appropriate training.
That is correct.
But if you don't have a math teacher, you find one, right? If you don't have somebody who can teach technology, you find one, right? So that becomes a political issue that probably needs to be pushed differently. Yes,
But Ms.
please.
Fields, you know, and I don't have to tell you this, it comes down to a mandate. It comes down to, we keep HIV and AIDS in the New York City Department of Health or the New York State Department of Health, or we rely on the AIDS Institute. We, as people, here, as voters, we keep everything about HIV and AIDS in this medical portion. But yet when we talk about poverty and we talk about education, we talk about all of that, nobody is bringing those other bureaus, if you please, to the table. Nobody is mandating with the chancellor or anybody else saying that, look, you've had a curriculum for X number of years. We know it's there. You have to hire the proper people, or the Board of Ed is responsible for making sure that our children get the education about HIV and AIDS. The other thing I wanted to say is, yes, there are large organizations. Took a long time for us as black folks, and I'm talking about black people now. It took a long time for us to get the Urban League at the front of the table, to get the National Action Network at the front of the table. Took us a long time, Ms. Fields. Some of us been around since the 80s when this disease started. But now we have them. You have a big name. I appreciate the advice in terms of what we should do, but it should be mandated from you to help us make our voices heard through the National Action Network and say to everybody, we're in the lead here and our people are behind us. This is what we want to see. Write the letter. We'll sign it.
Okay. So we're gonna have 2 more comments from the panelists, then we coming out there to the audience, because I see everybody out there beginning to raise your hand, and this is fabulous. Okay, Kaz, you wanted to say something, and then Hector?
Since you revealed that behaviors have changed, one of the things that I'm going to urge and Blocka to introduce, and this is where Circle of Voices is finding our strength. As you know, the world is not just gay. The world is not just LGBTQ. The world is just not what it was when this epidemic struck. We have a whole different group of people that are so free with their sexuality. They're doing things that LGBT people don't even understand. I have gone to the meetings and worked with these 20, 30-year-olds that are, and I was like, oh, you're not gay. You were a female that's now a male that's with someone who was a male that's now a female, and y'all are having sex, but not anal, but he is not. And those are the people that have been revealed as the people that are at the highest state of this epidemic. So by the time we get the school on board, they're going to miss this group. So I'm saying, again, we that do the real work will sign the letter because we know the truth. Because I'm out there in the trenches. I'm working with trans groups now, like Brooklyn Boyhood, and seeing the difference in our behaviors between LGBT and the queer folks. And let me tell you, we're going to have something that's going to come through on this HIV/AIDS that's going to scare all of us, because they're doing things that are different because they have choices of people.
It's interesting that you should say that, because I was at a national conference in San Francisco a couple of weeks ago, and the same discussion came up about knowing the sexual activities and behaviors that are actually taking place, and in many instances very different than what many of us know, whether you're cis, whether you're trans, whether you're LGBT, whether you're straight, however one defines themselves. So I think that is very important. Okay. We're going to come out there now. Oh, I'm sorry. Edwin, I'm sorry. Earlier, you want to comment on any of the issues that are
Yeah, I just feel like in Bed-Stuy, there is a lack of education. I think there's lack of, I would say, testing, really. I don't see a lot of testing in Central Brooklyn or Brownsville. You're in Bushwick.
But we go all over.
But I think that we need more of that.
New York on a regular basis.
And I think a lot of times these folks don't get tested without any kind of incentive.
Right.
I think that's a big issue also.
So you're saying that there needs to be incentives for people to get tested?
Yeah. They won't get, I mean, the population, certain populations, high-risk populations won't get tested because of either their stigma or they don't think it applies to them. But yeah, they want a Metro card, or they want a gift card, or they want $20, or they want $50. And it kind of just ruins it. They just don't want to get tested just to know their status.
You know, I just wanted to mention,
Hector?
yeah, I just wanted to mention that, you know, basically, it's that complicated, like she mentioned, you know, what's going on in society today. It's not as simple as just providing education piece to people. You know, I think that a lot of these young men that are getting infected with HIV, they're very well educated about HIV, but there's a lot of other issues involved with that. You know, homelessness, a lot of young men are homeless. Basically, they're having sex for survival. Basically, they're having sex for a meal. They're having sex, you know, just because they don't have no other options. You know, and I think that when you start looking at these numbers and this epidemic in a different way, because it's not just all about that education. That education is needed, especially now when they're talking about U equals U. Anybody knows about U equals U?
Yes.
So, you know, basically, what we're talking about is undetectable, untransmissible. Are the community getting the right messaging behind that? Because I don't think that they are. You know, I think that they're listening, they're hearing, and they're thinking that it's okay to go ahead and have unprotected sex with somebody who might be infected with HIV. And basically, the messages need to get out there, the prevention messages need to get out there, and they need to get out there properly. I don't think that just a social media campaign is sufficient, you know, because, you know, I found myself in a position not too long ago that, you know, how do I explain my clients about U equals U? What are some of the messages that I should be giving them or delivering to my clients? You know, what is my responsibility and my role when it comes to that? Sure that they have the right information.
It's an inside game
Yes.
for us, U equals U.
And people
And all
don't
the
have
other
it. People don't have the
acronyms.
right information. You know, they listening to whatever it says on a billboard, whatever it says on a show commercial that it doesn't explain anything. But when it comes to basically sitting down and understanding, you know, like the doctor explained over here about, you know, the viral load and what happens when you do D, when you do A, and it turns into B. That's the type of education that needs to take place as well. You know, because people don't understand.
You're absolutely correct. I
but
gotta
testing,
go out
but just
this
one
way.
thing about testing.
One last thing.
Just
about
one thing-
testing. Go
one
ahead,
thing.
Dr. Sweeney.
One last thing about testing, because one of the fallacies in our community is that getting a test is prevention. That's not primary prevention for you. It may be primary prevention for the person you're gonna have sex with, but it's not primary prevention for you. So you have some people that go and get tests all the time because they're basically dodging bullets. Oh, I've been having sex for 3 months without a condom and I'm not positive. That encourages them to have sex. So that's right, to dodge more bullets. So that's one thing. The other thing is there was just a piece, the one time I watched TV recently, I saw about a man, this is not new, who let stopped his medication so his CD4 count would go down below 200 so he could get an apartment. And so they used to talk about bug chasers, but it may not be what people are calling bug chasers, but as the guys used to say, when I would go around, the first time I went to give a lecture in Bed-Stuy as assistant commissioner, they asked me, what are you gonna do about the people who are getting infected for the bennies? Everybody know what the bennies are? And what the phrase on the street is, if you ain't got nothing, you ain't got nothing to lose. Just think of all the benefits of becoming infected. And although I don't have the data from the Department of Health while I was there, we did a little study that said, are there any benefits becoming infected? And there was a significant number of people who said yes. So we have to look at the unintended consequences of some of the things that we do in New York, because New York has never had a waiting list. You can get medication if you're documented, undocumented. You can get tested without money. You can get tested at any age as long as you understand what's going on. So we need to look at why a certain group of people, men who have sex with men, 67% of the new infections in New York City this past year are getting infected, and it's often not because they don't know. Okay, thank you.
Let's go to our audience. We have to be true to our word. Let's start over here, then we're here, then here, we're here. Okay, let's go. Yes, you?
First of all, I would like to say thank you, Sandra, for the invitation. And also I would like to say thank you to all the panelists, because I know individually that each of you are doing a spectacular effort in our community that sometimes is not reflected in the way funded is distributed. And here it's two things. First of all, we keep thinking as dependent, and when I'm thinking as dependent, we black people always complain about others not doing things for us. But when it comes for us to do things for us, we don't find the time, we don't know how to do it, we don't have the professional background. And then what we keep seeing in the statistics is black people and Latinos has the devil of the society bringing diseases and spreading diseases. So when we are talking about political, we are not talking about political in the way money is distributed, but in the way our people, black people, thinks of politics. And then we don't know how to create a strategy only for us, because what is killing, what this virus is killing is our people. You don't see white people in the statistics, even though they are still infected. So when you talk about the disease, you mostly talk about black and Latinos. Why? And non-white people, they have the same behavior. They are also engaged in the same risky environment. Why nobody is talking about them? And another thing, it's about young people. Our young people, they understand pretty well what's going on. We are the ones that don't understand them. Because we are trying to put a model, an adult model, for them to implement it. And it's not working. And what we don't see in those statistics is that young people below 16 are getting infected in higher numbers than in the early years. So why we are not talking about them? Because we are not talking to them.
Okay.
Thank you, yes.
Thank you.
Go to this side. Cross, and then we're back over to.
Good evening. I'm Melissa Baker, and I'm with the National Black Leadership Commission on AIDS. And just really quick, as a parent of a 14-year-old daughter, sex education is being taught in schools, but it's the schools where it's predominantly white or the children are considered gifted and talented. And I learned that because my daughter received the curriculum in 8th grade, and I inquired based off of what I do for a living, well, we keep hearing this curriculum isn't being taught. And the principal said to me, our children are special, and we don't want sexual health to be a blip in their future. And I was hurt as a black woman, but I was told, well, you have a child in the city, but I'm looking at all of our children and not just the specific children in the school. So when the gentleman talked about advocating, we need to be going to our schools, to our school district meetings, and advocating that this curriculum be taught, because there is funding, but if we sit quiet and be ignorant, they're going to do, and our children are ones going to be hurt.
Okay. Yes. Yes, the right lady there. No, I'm sorry, I was pointing over there. She's had her hand up 100 times. Then we'll come back to you. You go be heard. But I was, yeah, there you go. Thanks.
Thank you for sharing that, because I had a comment when you mentioned that sex education isn't being taught.
Could you give us your name, or if you're with an organization?
Oh, sure. My name is Estefania Amparo, and I am with Arthur Ashe Institute for Urban Health. And I just wanted to share that in the last couple of years, I've had conversations with two young women that are in the 20 to 29-year-old age group. And granted, they do come from different boroughs, but they did say that they are receiving the sexual education in their schools. What they're finding in their peers is that they have been so bombarded with sexual education that they're starting to tune people out. So with everything that they're surrounded, I don't recall who brought up the media and, you did actually, and how sexuality is just free and everything is okay when 20 to 29-year-olds, children under, or adolescents under 20 are tuning sex education out, then how do we change that conversation to make it more inclusive? And then the second thing that I wanted to say as well, it was a question, and maybe it's a policy question, but we all visit the doctor for annual visits, or maybe not all of us, but a majority of us. And sometimes in those annual visits, cholesterol, blood sugar, whichever, are mandatory exams. With the numbers that we're looking at when we think of HIV and AIDS, maybe somebody could start having a conversation about making that HIV/AIDS test mandatory. I request it when I go see my doctor, but a lot of us don't even think about it. So a vaccine would be helpful, but making that test mandatory, you look at the statistics, maybe they're not aware, they're not even thinking that we should be asking that question.
Here in New York State, we have what we call New York State routine testing law. So that when you go, you can get tested, but you can opt out. You can say, I don't want to be tested. But we, again, one of the few states with routine testing law.
That's true, but in all fairness, even when I go to the doctor, if I don't tell him I'm
Right. See, again, that's another problem with respect to clinicians. They may look at you and say, oh, you don't look like you need an HIV. So that's very subjective. Exactly. And that is happening, and there are efforts underway to put more pressure, quote unquote, on clinicians and doctors to test people. They do not have the right to subjectively decide, you look okay, you don't look okay, let me test you, or whatever. But the person has the right to opt out, making it mandatory, as we were putting that law together about maybe 6 years or so ago now. Very hard to make it mandatory, but it came as close as it could, and it's on there as one of the routine tests. And if you see it, well, I don't want an HIV test, or otherwise you get a test. So it's the education of the physician. A lot is coming out here that we're not going to be able to go into this evening, but we're going to make a recommendation at the end of this meeting for some continued conversation. Here, then here. Yes.
Hi, my name is Chaplain Whitehead. I was born in Bed-Stuyvesant, and I work with Circle of Voices. I came here today because she said you was going to moderate, Ms. Fields. My mother worked with you in the 70s. Dr. Harris, Al Van, you are a mentor of mine also. You still talk in the same way you talked then. You know, very stern, very go-get, very, that's why I do the work I do with Circle of Voices. Because of what I saw in Bed-Stuyvesant then. I saw the hard work that the people in Bed-Stuyvesant was putting in. My mother was the PTA president for, it's 10 of us. From the 10th down to, from the 1st down to the 10th is me. In PS 93, junior high school 258, Mary Whitehead was right there. She was right there. Circle of Voices, I'm probably maybe more than half of the people speaking here today, I've done work with them in one
Capacity, that's right, girl.
form or another. I am happy to see this forum here today. I'm happy to see people sitting taking notes today. I'm happy to do the work that I do with Circle of Voices today. I'm happy to see some people that mentor me now. Because this is a fight that needs to go outside of this room, that needs to be talked about outside of this room. And I'm just so shooken up and so moved, and my voice is going to be heard outside this room from today's conference.
Thank you.
Hello, my name is Colette Boston, and I'm very happy to hear everything that has been discussed today. It is very needed. One of the things, since I work a lot with youth, that I realize that many of us are not understanding when it comes to the youth is this, that many of them, the world may seem like it's an awesome place because they're young, but this world that they're living in is a horrible place. It is full of uncertainty. It is full of things that are unexplainable. Many of the things that we took for granted, they cannot take for granted anymore. It's not only violence, it's not only safety issues, it's not only bullying. It is sexuality, it's gender fluidity. It's talking about so many different things that we never even had to worry about. It's being fearful to be yourself, fearful not to be yourself. It's so much that's going on. And with the youth, we not only need to talk to the youth, but we need to talk their language, and their language is technology. We have got to start getting the youth who are techies to develop apps for us so that people who want our information, they have to go through those apps to get it and pay to get it. We can start withholding information, and I don't know why information has not been withheld without money being exchanged. We have that power. The other thing when it comes to funding is crowdfunding. It is the biggest new thing that's out there. They're using it for real estate. They're using it for so many different things. Crowdfunding is the new thing. And you would be surprised how many people want to be a part of something bigger than themselves. People want to give back.
Thank you. And I think, thank you so much. Okay, we have one last question over here, and then I'm going to ask the audience to, I'm sorry, the panelists to take 1 minute to summarize, 1 minute each.
My name is Akua Ansa, and I'm a career health educator. Thank you. This is a wonderful conversation. I've been in the schools as a health educator. The principals who cared and knew what their students were doing brought us in as community-based organizations, but they said, don't give handouts, you know, because they'll get to the parents. So talking to the youth, for me, yes, it's part of the equation, but the youth, they know a lot. I've been educated by youth in some of my classes, and it's the parents, you know, in those communities where parents speak freely to their children about sexuality and they don't feel like giving information means condoning sex at a young age, is those parents who aren't in denial about what their children could possibly do, who haven't forgotten when they were 16. And those are the ones who have children who, you know, take the decision making into their hands to protect themselves. So while we have to educate youth, and while we have to get funding and educate communities, we have to educate parents, and in teaching parenting skills, add talking about sex and sexuality and HIV and sexual health into the conversation, because sometimes that is the barrier for schools and after-school programs and just having a real conversation about this, especially in our community. West Indian people, they don't talk about sex. We have babies, but we don't have sex.
As you can see, there is a great deal of interest and good suggestions on the topics that we are that we've had. So what we're going to do, I'm going to ask each panelist to take 1 minute to just say whatever you wish to about what we've discussed, or if we haven't discussed something tonight, and then we're going to make a recommendation about a couple of next steps. We'll start at this side with Ms. Ellen Cates, and we'll go zigzag again.
This has truly been informative, and since I've been in this field for over 24 years, actually 30 years, I've seen things go round and round in circle. I've seen so many changes. And today has set a tone that I think something Ms. Bailey said was that we need to put our words into action, albeit a letter, and really put down on paper, pen and paper, some of what we've been discussing here today. It's critical. School by school, education, sex education is being taught in some of the schools because I work with a group of young women, but we creatively work with these young women and we use their funding sources. When they go into, like dating, date rape, and we use those areas and avenues to get the information through. We use creative things in my office, such as the different apps in reaching out to the community. There's so many apps these days now, social media, and we have a group of young men that work in that area, and they reach out to those. They meet them where they're at, dating sites and so on and so forth. And we've been pretty successful in getting them in to test, taking prep, and so on and so forth. I think today,
I think we're gonna have to wrap it up.
Okay.
1 minute, please. I'm sorry about that, but we were on a schedule and our borough president
No
is here.
problem. Glad.
But thank you so much. There's gonna be another opportunity for you to put all your good ideas into an action plan. Dr. Rodriguez, would you like to comment at all? 1 minute, everybody.
Thank you so much for having me here. I'm not sure if everybody's aware, but there is a relatively new mayoral task force specifically to discuss sexual education in New York City. That's going to be making recommendations in the next quarter of 2018. So I think if you want to be somehow putting your input into that process, speak to those individuals that have been put onto that task force, and if you don't know who they are, feel free to email me and I'll put you in contact with somebody at the health department who is. I think, just very quickly, the numbers are only part of the picture. I think a lot of what we have to do also is just relationship building across different stakeholder groups and making sure that the voice of the community is always kept at the center. I've had an experience recently where I've been hearing a lot of stories from consumers, people living with HIV/AIDS, and it's been really powerful to bring the work for me alive. So I just want to keep that in mind.
Thank you. Edwin Dillard.
Yeah, I feel like we still have a whole bunch of work to do to reach this, especially the MSM of color community. I just think that we need more education and prep is one big thing I think that our community still doesn't really know about, but still not educated enough about it. So yeah, I just don't know how we can really figure out how to get them educated. I mean, that's one of the big challenges still, I think, that we have.
Hector?
Yeah, well, it is my hope that this conversation don't stop here. That basically just because we are celebrating another World AIDS Day event, that basically all the expertise that we have in this room, all the information that we have and we share, that there's some next steps to this. That basically we have a group of people here that will be able to inform what are the funding priorities for this borough, to be able to basically continue to decrease the new diagnosis of HIV and AIDS, and probably increase people who are getting connected to care, who are becoming violently suppressed. Because I think the conversation is not just, 1 hour sitting in a room and just talking about it. I think there has to be next steps, and I think that we can make it happen, and we need to involve our city council members, our assembly members into this process. They have member items, I think that when you put a little bit from this part and a little bit from that part, we might be able to come up with something that might be helpful in helping Brooklyn be one of the boroughs with the lowest number of people getting infected with HIV and with the higher number of people violently suppressed.
Okay, thank you. Dee Bailey?
Yeah. basically, I just want to say partnerships are key. If we didn't know it walking into this room, we've been involved with HIV and AIDS for so long. But partnerships are the key. I started out my statement when I walked in talking about the coalitions that we lost, the HIV networks that we've lost, all of those partnerships, working partnerships that resulted in our own decrease in the spread of HIV and AIDS in our community. We have to get back to it. I direct your attention to Our Time Press. It's our newspaper that comes out every week here in Brooklyn. They gave me a statement to put in there for World AIDS Day, and it just speaks to a unique partnership between Dr. King and Bayard Rustin back in 1963, when they were coming together against the wishes of many people. They encouraged Dr. King, don't work with this guy. This guy is a gay man. This guy's partners are white gay men. And so it will take away from the movement. And thank goodness Dr. King didn't listen. He went ahead and formed those partnerships with Bayard Rustin and his crew, and they did what they needed to do. So partnerships are key. And the one thing I want to say about our young people, some of our young people, particularly the ones that work with Watchful Eye and in the Cobra Martial Arts Academy, they know about HIV and AIDS because some of them have lost one or both of their parents to this disease. So we should not sit back and think that these young people don't know about it or they're reluctant. They want to speak out. They need a voice, they need a vehicle, they need funding. Mr. Borough President, they need funding so that they can get their voices heard and it not be clouded through our voices and what we're talking about with our history and all that. They have no history. All they want is to be out there to encourage people to do what they're doing, get off the streets, you know, because these kids are dealing with homicides and everything else, but HIV and AIDS is first and foremost in their brain because they're worried about dying themselves. And they don't want their friends and family members to die. So I just want people to understand there's another side to what the youth and what the youth are thinking.
Dr. Sweeney?
Thank you I'm very happy to have been a part of this panel. There's so many things we need to talk about, but I will just close with partnerships is definitely one, but having broader partnerships. We're often siloed, and we come together, and then the education people are not at the table, and the funding people are not at the table, and the legislators are not at the table, and what we really need is to have a conversation with all of the stakeholders, including somebody who has gone through this at the table to put their perspective. The other thing is even without a vaccine, Seattle, Washington has reached one of the goals, which is the World Health Organization goal, and New York State's goal is pretty similar, of 90-90-90. 90% of the people who are infected know they're infected. 90% of the people who are diagnosed, and 90% of the people are on treatment. We need to look at other people who've been successful to see what it is they've been done. Now, first of all, Seattle's very small, but we can still take the model and then use it here in New York. And I know our commissioner, and many of you do, she keeps the patient's voice and the community voice right in the center, and we need to look at what they've been able to do to get to 90-90-90. The fewer people who are infected and the more people who have viral load suppression is the fewer people that are going to transmit the infection and keep the epidemic going. So we need to do 90-90-90 at a minimum.
Dr. Johnson?
Through our Gilead study that the Arthur Ashe Institute conducted to increase knowledge of PrEP and PEP, but also to increase testing, one of the startling results was that we were able to increase knowledge about PrEP and PEP, but what remained stagnant was comfort level with testing and having the discussion. And so, for example, if we were in the barbershops and salons where we got all of our participants for the study, a lot of them would say, well, if I could do the testing now, here, with you, then I would do it. And so a part of the conversation is what happens after we leave the barbershops and the salons, from after we've conducted an intervention or a training in that safe space. what tools have we left them so that they do feel comfortable proceeding going forward. And then the last thing that I just want to say is echo that partnerships are so important. So even in thinking about the people here on this panel, that if I don't know you today or if we haven't met, we should leave with contact information and we should reach out to each other and we should work together after today.
Dr. Ponder?
And I accept that challenge, Dr. Johnson and Ms. Bailey, to work together and to partner. Currently in the United States, as you know, we are guided by a national HIV/AIDS strategy. We have specific targets to move people living with HIV through a continuum of care. We wish to increase the linkage to care to 80%. That's a goal. We want to increase the proportion of people living with HIV retained in care to 90%. And we want to increase the viral suppression to 80%. And this is the ultimate target. And in my 20 seconds, I want to sum up by saying, as you can see from both this national HIV/AIDS strategy and the blueprint that Ms. Fields was on the task force to form for this state, we don't have different targets. We don't have different targets. Bed-Stuy. Even though we have disparities by race, ethnicity, and also socioeconomic status. I'm sorry, we're 12 seconds old.
That was a lot of drama. And Cass Mitchell, you have the last word from the panelists.
Well, first of all, I want to thank all of you for coming. And when you leave, I want you to tell all those that didn't have time for this to know what they missed. If this was a party or Soul Summit, they would have been here. So on that, I want you guys to look for Circle of Voices. We're partnering with groups like Soul Summit and trying to have some kind of health services, because that was one of the first things I went to Council Member Carnegie with. It's not just a party, but we have mental health issues. We have people with diabetes, high blood, and most of them are people of color, and they're just out here dancing, and you're letting them get away. So there will be some more conversations. And I'm just so happy to be a black woman, because 50 years ago, my ancestors could not do this. So I'm grateful to also have these two wonderful individuals here as people of African descent. Because I came to see Virginia Fields, I served on the LGBT Advisory Council, and she heard my voice. And we're still talking today, because that was in the 80s. And Borough President Adams, I came to you when you were our state senator, and you heard Circle of Voices. We have been blessed and trusted as a valued community member to work with the LGBT, same gender loving, and all orientations. So I want you all to go out there and tell people, get tested, volunteer, roll up your sleeves, and if it takes a party to cure us, then we're gonna have a lot of parties. And again, thank you all for being health conscious. I appreciate you. God bless everyone, and who you pray to, please let them carry you safely.
Let me just do a couple of things before I pass it over to our Borough President here in Brooklyn, and thank him again for making it possible, along with Circle of Voices, to come together. Clearly, a lot has been said, and I think someone mentioned the level of ethics was Hector, the level of expertise and the knowledge from this end as well as both sides there is phenomenal. And we cannot and we should not allow this to be the last. So in talking with Sister Hamilton? Chapman, right. And since she was speaking for your voice, we would like to at least propose that the first of the year, second week or so of January, that we come back together for a roundtable. And we can decide at that point, and we'll reach out to each one of you for names of people who you think should broaden that discussion from many different disciplines. One of the good things about the National HIV/AIDS strategy is that we did reach into all of the governmental agencies and said, Education needs to be at the table. Commerce needs to be at the table. Institute of Health needs to be at the table, because it wasn't just the Department of Health or AIDS Institute in this instance. So we like to propose, and I work with be led by the Borough President's Office of Brooklyn to do this next step and bring in this round table together, because we don't want this to get lost. And lastly, we are at a very good point here in the state of New York, because we have a blueprint. That blueprint is moving forward, but we need to make sure it moves forward with Brooklyn at the top of that list. We need to know now, if we're supposed to be reducing significantly by 2020, how are we doing that to ensure that the numbers in Brooklyn and these other communities of color of New York City? So it's like these report cards, if you will. And I think forming, or not necessarily forming another group, but coming together, having these discussions and developing an action plan that then each one of us can go forward in our own organizations, as well as working collectively to make it happen. I'm encouraged. I'm renewed by being here tonight. I really did hear you, and I am so much in tune with everything that I've heard you say as it relates to advocacy, as it relates to policy, as it relates to funding. So we're proposing that, Mr. Borough President, and under your leadership as the Borough President of Brooklyn, we would like to go forward and really see something come out of this with an action plan from this body and others who will be brought in. Is that acceptable, Mr. Borough President?
Yes, it is.
Thank you so much. With that in mind, I give you the Borough President of Brooklyn.
Every time I see Ms. Phil, I get optimistic, that there is a rich life after the Borough President's office. She served so well in government as not only a city council person, but as the Borough President of Manhattan. And much of what we do here, we duplicate what we saw that she accomplished there. And now, at the head of this national movement, we're so happy to have you here.
Thank you.
And continue to learn from your expertise. And we're encouraged by that. And, here in the borough of Brooklyn, we are probably the Motel 6 of America, because Watchful Eye always got an eye on us and what she's doing here. So let me say this. This is one of the topics that I am extremely clear on. I believe that allow the experts to do what they do. People, when you lean into your craft, it reveals its secrets to you. And many of you around this table, as well as sitting in the audience, you have leaned into this conversation, and you know the secrets of how to make this happen and how to do it in the right way. And I am here just to ensure that we implement those things. And just a couple of points that came out that I want to touch on. Three. Number one, I think Dee really touched it. This is the year of collaboration. If nothing came out of the madness in Washington, D.C., it came out of the fact that we need to start talking to each other and start collaborating with each other. Far too often, the duplication of organizations is just really depleting the limited amount of resources we have. There's only a limited amount of dollars, and those dollars are going to become even smaller as the years go on in the next couple of years. And so if we are attempting to fund 50 organizations doing the same things, instead of one organization getting the $50, you're going to all get $1 a piece to do nothing with it. It's just, we just cannot continue to exist under the previous model of many different organizations going after the same pool, doing the same things, and not getting any measurable results. Second, you have to inspect what you expect, or is all suspect. And there's a reason the Baptist preacher puts in front of the church a building fund where everyone can see, so you can't say we're raising money if those numbers don't go up. So if we're not measuring in real time how we are moving and hitting our targets, we have some great young minds out here that can use technology. That technology should be used on fighting this battle. Day by day, we should be measuring the testing. Those who are receiving the necessary medication that they need, those who are doing follow-ups. All of this information must come in real time. We're in a real-time universe now. In fact, any news agency that reports news just the next day is not going to be a news agency in business. It's about how do we use technology to measure what we are attempting to accomplish in real time. We can't continue to look year by year and say, well, we didn't hit our numbers, and the numbers are not what we expect them to be because we're waiting too late to measure them. It's about measuring them in real time. And lastly, finding entryways. As Kaz stated, the whole Soul Summit, we're doing a lot around health here in Brooklyn. And food and how people can eat well and to deal with their health issues, and we are holding parties and doing it. As we have a conversation around healthy meal, we're holding events. If I got to get you to dance to come and see the importance of eating kale, then I'm going to play the song to get you in the place to eat the kale.
That's right.
So if this environment is too sterile for people to come through the doors and have this conversation, then let's meet them where they are. The goal is to meet people where they are and take them where they ought to be, not meet people where we are and expect them to be there. So let's be creative in our thoughts and how we attract people to the table. We have so many lovely places in Brooklyn where people come to socialize and to have events. I know we have a beautiful events that we do here with Circle of Soul, Circle of Sisters, Voices of Soul. Tell me it right, let me get it right. Circle of Voices. Where there's so many people that come in and we talk about these conversations. Just the other day we had my LGBTQRXYZ, all those letters. We had an event here with our transvestite community who came and celebrated Transgiving. We've held here. Just the other day we had Plantsgiving. We find ways to get people into the building, so while they are acknowledging those things that are dear to them, we slip in some other things as well. And so our young people may not come inside this building to have this conversation in this manner, but let's find out how. Let's get a Beyonce. Let's get a LL Cool J. Let's get a Puff Diddy or P Diddy, whatever he's calling himself this week. Let's get him to be part of this conversation. Whatever is going to attract people in to the mission. The mission is to get the information to the people, and finding that entryway is so important. Far too often we're not hitting the mark because we're not finding the entryway. But I'm all in. Use this place as often as possible. Our office is fully behind this endeavor. The right team is in place to do the things that needs to be done, and I want to be as helpful as possible. But what I'm not going to do is dictate to you. You are to dictate to me. It is my job to go to those who understand the mission, understand what needs to be done, understand where we need to fill the holes, and I need to use this office to do so. We need legislators, we need negotiators, and we need agitators. It's the combination of those three bodies that is going to get things done. And let's not underestimate the importance of this borough. Brooklyn is, if it was an independent city, it would be the third largest city in America.
That's right.
The way goes Brooklyn, goes New York. The way goes New York, goes America. The way goes America, goes the globe. It starts here in this place to set the agenda that is of a national proportion. And so I thank you again for coming in and hosting this event. and we're going to do great things in the future. Let's emphasize our success. Thank you very much.
Thank you. Yeah, this is really good.
Before we